There are monsters among us, the shape-shifting, blood-sucking, disease-spreading type. Is that something that you would rather not believe? While a certain level of blissful ignorance can help us to sleep better, being naive to real danger can jeopardize those we love. Now, admittedly, today's video is a bit of a horror story because not only are such monsters real, they are interconnected with a condition that's often misdiagnosed, or worse, missed entirely. Lyme disease. A strange rash. Unexplained fatigue. Joint pain that just won't seem to go away. These could all point to Lyme disease. But how can we be sure? In this video, we'll uncover why Lyme disease is so hard to identify, its common symptoms, and we'll shine some light on the little horde of monsters that deliver it. Most importantly, though, we'll learn how to avoid it and how to advocate for proper diagnosis and treatment. But first, a warning. If you are sensitive to creepy footage, images that will make the skin crawl, or are prone to vivid nightmares, your instincts for this next scene might be to look away. We'll not judge you for that. In fact, our whole team was nauseated in putting this information together for you. However, understanding what to look for is key to protecting yourself and your loved ones. So, for the sake of all in danger, let's face the monsters together. Meet the black-legged tick. Now this one is fully engorged, which means it is feasted on blood to the point that it appears it will explode. It will slowly digest it, though, and then shapeshift back to a form that might be more familiar to us. Black-legged ticks are also known as deer ticks, bear ticks. They have cousins from other countries known as sheep ticks, castor bean ticks. In fact, you'll likely find yourself ticked off by the confusing array of names. So, to keep it simple, we'll just refer from here on out to the black-legged tick because it is the one that's most closely associated with Lyme disease. In fact, about 50% of black-legged ticks carry the bacteria that is responsible for Lyme disease. 50%. Now, the bacteria that's carried in these ticks are transmitted through the bite. Lyme disease is an infection caused by bacteria transmitted to humans as a result of an infected tick's bite. Cases are most common in wooded and grassy areas, but cases are on the rise in urban areas too. While they favor forests and shrubs bordering forests, it's wise to assume that they are waiting to ambush you in grassy areas as well. Early symptoms often appear mild: fatigue, fever, headache, or rash. But without treatment, Lyme disease can spread to the joints, heart, the nervous system, causing debilitating complications. Lyme disease is notoriously difficult to diagnose for several reasons. First, its symptoms mimic those of other illnesses like flu, chronic fatigue syndrome, fibromyalgia, and even mental health disorders. Second, not everyone gets the hallmark bullseye rash of Lyme disease seen here. The rash is a dead giveaway, but it only appears in 70 to 80% of cases. And if that rash happens to fall within your hairline, you may not even notice it at all. Without the rash, doctors may overlook Lyme entirely. And finally, Standard blood tests for Lyme disease aren't always reliable, especially in the early stages of the illness. Now, let's break down the symptoms of Lyme disease in its various stages. In early stages, common signs include number 1, fevers, chills, and muscle aches. Number 2, fatigue that feels overwhelming. Number 3, a headache, often paired with neck stiffness. And number 4, the bullseye rash that we mentioned earlier. Without treatment, Lyme disease can progress to a more serious stage to include number 1, severe joint pain and swelling, especially in the knees. Number 2, heart palpitations or irregular heartbeat. And number 3, neurological symptoms like facial palsy, memory issues, or nerve pain. It's important to note that these symptoms can mimic other serious medical conditions. So please be sure to watch all the videos in this series, including the one depicted here. Meet Rachel, a 29-year-old who spent over a year searching for answers. Her symptoms, fatigue, joint pain, and brain fog, were dismissed as anxiety or burnout. It wasn't until she insisted on further testing that she was finally diagnosed with late-stage Lyme disease. Stories like Rachel's are sadly common. Misdiagnosis can lead to months or even years of unnecessary suffering. If you suspect Lyme disease, here's how you can advocate for yourself or a loved one. First, keep a detailed symptom journal noting when symptoms start and any patterns. Second, and this is very important, mention any recent outdoor activities, especially those in tick-prone areas. Third, request specific tests for Lyme disease. And fourth, seek out a Lyme-literate doctor, a doctor who is familiar with diagnosing and treating Lyme disease if your symptoms persist without answers. Now remember, your health is worth fighting for. You can ward off the monsters. Don't be afraid to ask questions and push for answers. The good news is that early Lyme disease is treatable with a course of antibiotics. However, advanced cases require longer treatments and specialized care. Even with treatment, some people experience lingering symptoms known as post-treatment Lyme disease syndrome, or PTLDS. Recovery can take time, but with proper care, many regain their quality of life. Of course, it would be better to never lose that quality of life to begin with. And that's where prevention comes in. Prevention is absolutely key when it comes to Lyme disease. Please understand that the intention of this information is not to frighten you from going outside and enjoying the outdoors. We all need fresh air, and there's many beautiful places to visit. It's just while you're out there, take the necessary precautions. Here are some tips that will serve you well. Wear long sleeves and pants in wooded or grassy areas. Use a tick repellent known to be effective in your area. Check your body for ticks after spending time outdoors, especially in hard-to-see areas like behind the knees or around the hairline. And without being creepy, if appropriate, ask a friend or family member to help. If you find a tick, remove it promptly and save it in a container for possible testing. Early removal reduces the chance of infection. In conclusion, please indulge your narrator in a little rant. It is highly likely that some brotherhood or sisterhood of tick enthusiasts will be highly offended by some of the anti-tick speech included in this episode. Ticks are monsters, looking to ambush you, etc. To them, your humble narrator says, please, get over it. Yes, there are some beneficial functions that ticks serve, some of which we may not even be aware of yet. One such benefit, often proclaimed, is that ticks serve as a valuable food source for many other animals, and that's really nice. This is true. Still, if someone's burger jumped off its plate and attached itself to my unmentionables, that would not be okay. Am I alone here? Please leave a comment to set me straight. I would really appreciate that. Lyme disease can be a challenging journey, but awareness is your best defense. Know the symptoms, trust your instincts, and don't hesitate to push for answers if something feels off. Until next time, stay safe, stay informed, and protect the ones you love from monsters great and small.